In the next 15 minutes, I'm actually going to, I titled this a primer for primary care practitioners because I think that this is something that we don't learn a lot about in most kind of training curricula. And I think it's really important, not just for geriatricians, but for most primary care practitioners as our population is aging, and this is something that's actually quite prevalent. So let's just dive right in. So we're going to first lay the groundwork. What is elder abuse? Because it's something that a lot of people may not be familiar with. I'll present some facts and statistics about elder abuse to hopefully convince you about why this is important. And then we'll go over risk factors and what you should do when you suspect abuse, neglect, or exploitation in a patient that you're confronting in clinic. So there's a lot of different definitions for elder abuse. This is my preferred definition, and I'll tell you briefly why, but this was put out by the U.S. Department of Justice and the Department of Health and Human Services in something called the Elder Justice Roadmap, and it says that elder abuse is harm of an older person by another person or entity that occurs in any setting, so home, community, or facility, either in a relationship where there is an expectation of trust and or when an older person is targeted based on age or disability. And the reason I like this definition is, one, it highlights the fact that this is not just something that's happening in nursing homes, which I think is sometimes what's popularized in the media. This is something that happens in all the different locations that an older adult might be living. And I also like that it doesn't focus on the fact that this is only happening to quote-unquote vulnerable adults, which we'll talk about in just a minute, but this is something that may happen even to older adults who we don't classically think of as vulnerable. And under the broad umbrella of elder abuse are the following: physical abuse, verbal abuse, sexual abuse, financial exploitation, and neglect. And so it is important to understand this terminology, however, because it's relevant in terms of our legal responsibilities for reporting. So what exactly is a vulnerable adult? In Washington State, a vulnerable adult is anyone who meets any of these criteria. So 60 years of age or older with a functional, mental, or physical inability to care for himself or herself, found incapacitated, which this is actually a legal, not a medical determination in this case. Anyone with a developmental disability admitted to any facility, getting services from home health, hospice, or a home care agency, receiving services from an individual provider, or who self-directs his or her own care and receives services from a personal aide. So someone who needs help in the home, but they are directing that care. And I'll talk about why this is important in a minute, but basically this is where it is required by law that you report abuse if it is in a vulnerable older adult. So I always like to start out by saying that this is an area that is really full of shades of gray. So, of course, on the one end of the spectrum, you have certain cases that are clearly abuse, and oftentimes these are criminal abuse cases. And then on the other end of the spectrum, you have very appropriate caregiving. But in this world, I can tell you many, if not most cases land somewhere in the middle. And there's a lot of kind of uncertainty and sometimes ambiguity about, what is going on. And this is something that makes elder abuse complicated, but also makes it really interesting, and I think makes it something that deserves our very nuanced attention. So that's what elder abuse is, but why is this something that we should care about? So elder abuse is incredibly prevalent. Most studies suggest that there is an estimated annual prevalence in the United States of about 10%, meaning that about 1 in 10 older adults will have experienced some type of elder abuse in the past year. However, unfortunately, most cases go undetected. So a large study in New York showed that only about 1 in 24 cases is identified and reported to authorities. And while it is prevalent and also undetected, this is actually a really large problem regarding health consequences. So it's linked to a whole series of adverse health outcomes, including dementia, depression, and mortality. And here you'll see a graph from one of the first studies that showed the association with increased mortality that was published in JAMA back in 1998. And the bottom dotted line were APS cases where there was high suspicion for elder mistreatment, and you'll see at 13 years a much lower survival for those individuals compared to those who were not investigated because there was deemed to be very low risk of elder mistreatment, and compared to those who had self-neglect. Victims of abuse are also at increased risk of a whole range of healthcare utilization. So increased emergency room visits, hospitalizations, and nursing home placement, which, as many of you know, is sometimes the most feared outcome for our patients, even more so than, death. Some people being placed in a nursing home is an extremely feared outcome. And elder abuse is also estimated to cost the U.S. multiple billions of dollars each year. So I hope I've convinced you that this is a prevalent problem. This is something that really negatively affects older adults who experience abuse, but we're not doing a very good job of detecting it. So when you have something where it's problematic and hard to detect, understanding the risk factors can be really helpful in terms of improving our detection. So what are the risk factors for abuse? So we'll go through this in 3 different spheres. So thinking about risk factors related to the victim, risk factors related to the quote-unquote perpetrator or the trusted other, and then risk factors related to the context. So what we know about victim-related risk factors for abuse is that poor mental and physical health increases risk of abuse, cognitive and functional impairment, low socioeconomic status, social isolation, and female sex. These are all known victim-related risk factors for abuse. And you may notice that ethnic and racial, we don't have known ethnic and racial risk factors for abuse in the United States, so studies have not actually shown that here, but those have been found in other countries, and I suspect that that's really just that we haven't studied it well enough in the US yet. So just to talk a little bit more about these risk factors, so impairment in physical function. So when we think about this, there's a whole number of reasons that older adults might have impaired physical function. For example, hemiparesis following a stroke, limited mobility due to low back pain or osteoarthritis. And as people accumulate physical function impairments, it reduces their ability to perform their own ADLs and IADLs and increases dependence on another. And really, it's this dependence that places people at risk for experiencing abuse, neglect, and exploitation. And the more impairment in physical function leads to higher demand on the caregiver and an increasing stress in that caregiver-older adult relationship. You see a similar kind of downstream path for impaired cognitive function, which can be due to dementia, mild cognitive impairment, longstanding intellectual disability. But in addition to the difficulty with ADLs and IADLs, it's also important to understand that impaired cognitive function often also leads to impairments in executive function, which may lead to behaviors that make caregiving more difficult and also can lead to impairment in judgment, which predisposes to financial exploitation. Low socioeconomic status and social isolation both also greatly contribute to risk of abuse, and this is because it may limit caregiving options for older adults, also may lead to increased dependency, and may limit opportunities for abuse to be discovered or lead to a fear of consequences if it is discovered. So if an older adult feels that they don't really have alternative options, they may be very reticent to reveal an abusive situation. So what about risk factors for the person using abuse or the trusted other? We know that adult children or spouses are actually the most likely to be the abusers. They're more likely to be male. They have a history of past or current substance abuse, mental or physical health problems, history of trouble with the police, themselves being socially isolated, unemployed, or having financial problems, and also experiencing major stress. So these are all risk factors of the trusted other for being more likely to perpetrate abuse. And I highlight the top one, that adult children or spouses are actually the most common users of abuse, because I think that, again, in popular media, it's often thought of as hired caregivers or people in nursing facilities, but actually several studies have shown, and I highlight one below, that family members are actually the most common perpetrators of various types of abuse. And finally, context. So context really matters in an abusive situation. So there's a number of contextual risk factors, including social isolation for the dyad. And it's also important to remember that, like I told you, family members are the most common perpetrators of abuse. So these are relationships that often begin prior to any need for caregiving. And so a poor quality pre-existing relationship may also promote mistreatment after there becomes a need for caregiving. And it's also important to remember that different cultural norms may also contribute to likelihood both for abuse and neglect to occur, but also for difficulty in detecting abuse. So this is the abuse intervention model, which I'll just show really briefly because I like how it highlights the 3 different areas of risk factors that we should be considering and how these kind of really contribute to the risk for elder mistreatment in a way that I like to think of as a critical mass or kind of a threshold above which an abusive situation may occur. So it's really not any one of these risk factors, but when you combine all these risk factors related to the vulnerable adult, the trusted other, and the context, where you get above a certain threshold where abuse, neglect, and exploitation can occur. So finally, what should you do when you suspect abuse, neglect, or exploitation? So now that you know the risk factors, you may be looking for signs and symptoms of abuse in your patients. And I'll go through these actually quite quickly because I think we're kind of running short on time. But for neglect, you may see in the older adult lack of personal care and hygiene, malnourishment, dehydration, and other chronic problems that haven't been tended to, such as decubitus wounds. In the trusted other, you may see signs of abandonment, leaving person all day without the ability to care to their needs, failure to give medications appropriately, and withholding food and water. For emotional and psychological abuse, you may notice that the older adult is uncommunicative or unresponsive, that they seem excessively fearful, hypervigilant, depressed or confused, and the trusted other may be showing signs that they're restricting the person from checking their mail or withholding information, keeping them from seeing their friends, and other types of controlling behavior. In physical and sexual abuse, you may notice signs in the older adult of physical or restraint trauma, repeated unexplained injury, and hyperesthesia, so pain upon being touched, and any presence of an STI in a vulnerable older adult should trigger concern for sexual abuse. Now, there's increasing research trying to understand specific bruising patterns that may be more specific to physical abuse rather than accidental injury in older adults, which is really interesting. So just to kind of skim the surface, maxillofacial injuries and bruising, upper extremity bruising, especially the ulnar surface. So this is like a defense injury. So if you notice bruising on the ulnar surface, that should be kind of a red flag. And then torso bruising. And that's because oftentimes that is somewhere that physical abuse will occur because it's often covered by clothing. So people who are trying to not cause injury in noticeable locations. Financial exploitation, I'll just skip over this, but kind of living below means, personal belongings, anything where you notice that someone kind of doesn't seem to have the means that they should really have access to. And so all of these I call pink flags, and I get this terminology also from Laura Mosqueda at USC, and that's because, as you'll notice, many of those signs and symptoms are things that could have a number of different explanations in older adults. So by no means are these things that are specific for physical abuse, but it's important to recognize them as pink flags because if you don't think about abuse, you're never going to find it. And this is part of why the detection is so poor currently, because I think it's just not something that we are always thinking about when we see these different signs and symptoms. And so once you notice these pink flags, the next thing is to always interview and examine the patient alone if possible. Make sure to fully undress the patient during your exam, including feet, buttocks, and back, because you get really critical information that way. And if able and safe, interview the trusted other separately. And then you always want to make sure to document all relevant findings in the medical chart because this is important for monitoring and for possible prosecution in criminal cases. So now it's time to report. Always remember, reasonable suspicion is all that is needed to report, not proof. So it's not your job to prove that abuse has happened. If you have reasonable suspicion, you see things and you can't come up with a clear explanation of how they occurred, it's your job to report. I'll skip over this. This is just some information on exactly how you report and to whom. So really it's Adult Protective Services or law enforcement if you're concerned about a criminal act. Basically what will happen if it's a vulnerable older adult, APS investigator will kind of conduct a home visit and interview other individuals who are relevant to the situation and get law enforcement involved if necessary. But it is important to remember that even a vulnerable older adult has the right to make choices and has the right to refuse any and all interventions for or changes in it can change his or her mind, and withdraw consent to assistance from APS at any time. So often APS's hands are tied, and I think that this causes a lot of frustration on the part of people who do report, but it's important to understand that this is a legal protection for people. So that's it. This is the summary. Be aware, elder abuse is prevalent and under-detected. Always make sure to look out for pink flags, and when you notice them, gather the relevant information, report to APS or law enforcement if you have reasonable suspicion. Always involve your social worker when you're making a report because they can be really helpful in all the steps of this, and consider interventions to improve home function, cognition, and independence to reduce caregiver stress as first steps towards intervening. And those are just references for you.